Good morning, everyone. My name is Başak Balaban. I'm a clinical embryologist working in American Hospital of Istanbul, and I've been on the field for 20 years now. And today I will be talking about EmbryoGlue for improved take-home baby rates. So it's of no doubt that the major mission of an embryologist in a clinical embryology laboratory is to create and then select the best competent embryo that will be transferred to the patient. So within these missions, the most three important subgroups are culture viable embryos, and then afterwards, once you culture them viably, then among them we have to select the best one with the objective way, the best objective way as possible. And then finally we have to transfer them successfully. And today I will be talking about enhancing implantation by the transfer medium. There were several micromolecules that were placed in the embryo transfer culture media with the hope of increasing the implantation potential of the embryo. So even though the previous micromolecules that had been studied had no beneficial effect on the implantation potential of the embryo, hyaluronan had some beneficial effect that had been reported clinically in the literature. We know that it's a naturally existing molecule which is in the female reproductive tract and is present in the human endometrium. And the theoretical advantages, the mechanism how hyaluronic acid works, is the first one, the adhesive role. The second one could be the physical effect by acting as a viscous solution. And the third one is on embryo or as an endometrial effect. And the reported clinical advantages of hyaluronan is it supports the pre-implantation embryo development, so it keeps its viability very high, and in connection to this it facilitates the embryo implantation, and it has been reported that it also improves the cryosurvivability of the embryos. And the recent Cochrane data, which was published in 2010, had reported that it significantly affects the implantation as well as clinical pregnancy rates. And the very recent Cochrane data, which was revised in 2014, had also shown that it has a significantly beneficial effect on live birth rates as well. So today, very recently, another meta-analysis, which was held in 23 different clinics, which was almost 10,000 embryo transfers, and now today it has been used for more than 1 million embryo transfers. So if you look at the recent Cochrane data, which was published in 2014, as you can see here, out of these studies which were included in the Cochrane data, as you can clearly see, the live birth rate was significantly increased when EmbryoGlue was used as the embryo transfer media. And when we do a subgroup analysis, when we look at the cleavage stage embryo transfers as well as day 5 blastocyst transfers, we will see the same effect. Again, the live birth rate was significantly higher for both subgroups. So coming to the Cochrane conclusions, it is obvious that it increases 8% in live birth rates with number needed to treat 12.5. Even though it was thought that the primary mechanism how hyaluronic acid works is the adhesive role, it was not the case for this Cochrane data because it increased the results not only for blastocyst transfers but also for cleavage stage embryo transfers. So it's most likely that it has an effect on the embryo as well as it might be affecting also the endometrial receptivity. And another very important thing that we need to notice in this Cochrane review is that the improvement in the live birth rates was more evident for the studies where the embryos were cultured in an environment with hyaluronic acid in addition to hyaluronic acid in the embryo transfer. So most probably hyaluronic acid might be having a gradual effect starting from the very beginning of the embryo development till embryo transfer. And then, as I mentioned in my previous slides, a very recent meta-analysis had also been presented in the recent Alpha Society Congress. And as you can see, it has been reported that the patients where the embryos were transferred in antihyaluronic acid environment, both fresh and frozen embryo transfer cycles, the clinical pregnancy as well as implantation rate was significantly higher. And it was very important to see that this media had no adverse effect. As you can see, the miscarriage rates were similar between the study groups. So actually one of the largest trial that was included in the Cochrane data was published by our group in 2008, which was held on almost 700 cycles. And we had reported in our prospective randomized trial that clinical pregnancy as well as implantation rate increased significantly with the utilization of EmbryoGlue for embryo transfer. And the number needed to treat for one additional pregnancy in our study was 17. The beneficial effect was even more prominent for subgroup of patients like advanced stage and for women who had at least one previous implantation failure and in women who had poor quality embryos for transfer. And if we look at our data, the clinical pregnancy rate, as you can see, even though the clinical pregnancy rate was improved, the results were not significantly different when we do a subgroup analysis for day 3 and day 5. But when we look at the overall data, as you can see, the clinical pregnancy rate was significantly higher when EmbryoGlue was used. If we look at the implantation rate in the same study, as you can see, the implantation rate in overall, as well as for subgroups for day 3 and day 5 transfers, was significantly higher when EmbryoGlue was used. So if we do a subgroup analysis, as you can see, the clinical pregnancy rate was improved for the woman of advanced stage and for women who had at least one implantation failure and for women who had only poor quality embryos. Implantation rate was significantly improved for all subgroups, as you can see, for advanced age over 35, for women with previous implantation failure and poor quality embryos group. So as a follow-up of this study, we also presented our delivery data very recently, and as you can see here, when we look at the overall delivery rate, as you can see, it was significantly increased with the utilization of EmbryoGlue, and this was obviously significant also for day 3 as well as for day 5 embryo transfers, and the children born per transferred embryo was also significantly higher for the group of patients where we used EmbryoGlue as the transfer media. So as a conclusion, we can clearly say that now there is sufficient evidence-based data clinically showing that EmbryoGlue has a beneficial effect in take-home baby rates. And today it has been used over 1 million transfers, and it has been reported over 10,000 transfers, showing that increases the take-home baby rate. Thank you very much for your attention.